March is Endometriosis Awareness Month. So how do we know if it's endometriosis or just bad periods? We're going to dive into that. But first, 5 interesting facts about endometriosis. Number 1, in addition to period pains and sexual pain, endometriosis causes infertility. In fact, 50% of infertile women have endometriosis. But did you know that endometriosis can also cause problems with pregnancy, including preterm delivery, low birth weight, severe bleeding at delivery due to placenta accreta, and case reports of appendicitis and even spontaneous rupture of bowel have been reported due to the tearing of endometriosis from the bowel scars as the uterus grows out of the pelvis. Fact number 2, although endometriosis classically presents during a woman's reproductive years, it can also cause pain in women before puberty and after menopause. Fact number 3, endometriosis is uterine tissue that occurs outside of the uterus. The scar-type tissue is stimulated by estrogen and most commonly causes inflammation of the pelvic organs, including the ovaries, bowel, and bladder. Fact number 4, endometriosis of the ovary, or an endometrioma cyst, contains a thick fibrotic wall and surface adhesions. The cyst contains a thick syrup chocolate-covered liquid and are actually referred to as chocolate cysts. Which fact is most surprising so far? Which do you want to hear more about? Type 1, 2, 3, or 4 in the comment section below. And fact number 5, can ovarian endometriosis turn into cancer? We'll come back to that, but keep watching to find out. Now, as we open the video, I'm sure many of you are wondering, is there a difference between just really crampy periods and endometriosis? So let's take a look at the clinical perspective of what a standard period cramp involves. So every month, you're going to have a process where an egg is ovulated, and this will result in a menstrual flow if pregnancy fertilization doesn't occur. So during this time period, somewhere between 3 and 7 days, there's going to be a lot of inflammation, which will result in cramping. Now, typically, this can be managed with over-the-counter medicines like Motrin, ibuprofen, or Tylenol. But if we're experiencing pains that are much worse, medications aren't touching that pain, or you need to take time off from work, then you likely have endometriosis. Now, endometriosis involves the entire pelvis, not just the uterus. And over-the-counter meds won't work here. It may actually require narcotic medications or nerve medications to manage this severe level of pain. And because the inflammation involves the entire pelvis, it could affect the bladder, resulting in urinary urgency or leaking during your period. It could affect the bowel. This could result in diarrhea or constipation around the period time. And in severe cases, there could actually be blood in the urine or blood in the stool. In addition, a patient might experience nausea, stomach upset, bloating, and oftentimes pain with sex. As a physician, I suspect endometriosis in patients who constantly use a heating pad, and there's actually a thermal damage to the skin that can occur. That can be a telltale sign. Another red flag is a patient that has pain that's so bad they end up in the emergency room or urgent care. Unfortunately, since most imaging can't detect endometriosis, patients rarely get the help they need in that setting and are dismissed, or even worse, are labeled as drug seekers. Our patients with endometriosis need help, and more awareness needs to be brought to this topic. The average patient sees 7 doctors and has 3 surgeries before they even find an expert who can treat the disease. But you can skip all that pain and frustration by contacting an endometriosis specialist that we'll include with a link in the description. Now, how do we treat endometriosis? So you can view many of our videos that talk about natural treatments, pain medications, and hormonal therapy. Although all of these treatments have multiple purposes, there is one medication that was specifically designed only to suppress endometriosis called elagolix. Now, if surgery is required, make certain that your provider performs many of these surgeries in their practice, and that they don't just burn or ablate the tissue, they actually perform a surgical incision. Are you enjoying this content? Take a second and subscribe and turn on your notifications. As promised, the answer to the 5th question. Advanced endometriosis of the ovary can more than double your risk of ovarian cancer. 1 in 10 women have endometriosis and suffer from this condition. Please share this video.